I am Dr. Rishi, the co-chairperson, Department of Dermatology at Delhi Sir Gangaram Hospital. Today I'll be talking in brief about something which troubles a lot of Indians. It's a disease of the colored people, which is the hyperpigmentation. India, as we all know, is a fairness-obsessed country, and I'll be trying to put some amount of light, basic light, on this topic. Hyperpigmentation, as we know, in skin means one part of the skin becomes darker than the other skin. This can be due to several causes. The most common cause in India, which is a tropical country, is the sun exposure. Then the other causes could be any kind of injury, any kind of, drug reaction or any other thing which causes post-inflammatory hyperpigmentation. This can happen after various diseases like chickenpox or atopic dermatitis or fixed drug eruption, anything we can have post-inflammatory hyperpigmentation. Then there are hormonal diseases. For example, melasma, chloasma, mask of pregnancy. This is caused because of the hormonal change mainly. It could be genetic, it could be due to iron deficiency, foolish beauty parlor procedures. It can be because of sun exposure and mainly reproductive females. Then we also have, during pregnancy, several parts of the body becoming darker. For example, the nipples or the underarms can become darker, and we can have a linea nigra, which can happen. Then several kinds of quack formulations, which are called botanicals, plant-based, are also being used, which can cause, allergic or irritant contact dermatitis. This is mainly increasing in India. That can happen. How do we go about, treating it? Thing is that A, B, C of sun protection is avoidance of sun exposure, especially in India between 10 a.m. to 4 p.m. B is wearing a broad hat, broad spectrum antibiotic, sunblock. And C is cover up. Covering up means wear fully covered clothes, You can wear broad goggles, normal hat can be worn. And the sunscreen preferably should be, 50 plus SPF. Though SPF has gone out of favor, we have various other ways of judging a sunscreen. It should preferably be non-comedogenic, which does not cause acne. And the sunscreen needs to be reapplied after 2 to 3 hours of application. And there's nothing called a water-resistant or waterproof sunscreen as was there. These are just marketing claims made by the companies, which should be discouraged. Second thing is that if the pigmentation is, for example, we take a case of melasma, hydroquinone, fortunately, unfortunately, I use between 2 to 4% of hydroquinone in creams as well as lotion. Then we can mix it up as a Kligman's formula. We all know the Kligman's formula with the retinoic acid in a low concentration as well as the lowest amount of, weakest corticosteroid, which is the fluocinolone. Many of the pharma companies are selling, with mometazone, which is a moderately potent corticosteroid and comes with its own problems. Then creams containing glycolic acid, azelaic acid, various arbutin, various kinds of creams are there. Then I also rely on chemical peels. The most go-to peels for me are the glycolic acid peel or the arginine, vitamin C peels, just the superficial or the mid-depth peels. Then lasers can be used with caution. The Q6 Nd:YAG laser can be used. The IPLs can be used. Some of the people also use cryotherapy, but I do not use cryotherapy because it can lead to permanent depigmentation, of the skin. And we need to understand that the patient needs to be counseled very well. Another thing which is ignored in our market or by the doctors is the camouflage. Once we know that, the disease may or may not go away and the patient is feeling socially awkward, a chemical medical camouflage can be used, cosmetic camouflage can be used. And the majority of my patients are told that, while we are trying to improve your diseases because of various modalities that I'm using, camouflage can be used, to tide over the social occasions like marriages or any parties. And this is how I manage hyperpigmentation. Thank you very much. My plea to our patients is that do not self medicate. All the people who have been claiming on the newspaper or the social media or the Instagram or the Facebook about the miracle cure or the herbal cures, we should know that get the information from the right source. And this is where dermavidya.com is one of those sources which are providing human services not only to the qualified dermatologist but to the layperson, the patient. Do not try to self-medicate or use, medicines of dubious value on hearsay because they can cause permanent damage. One of the damages that I've seen in hyperpigmentation is uchronosis, where you use the very high concentration of hydroquinone, wherein permanent pigmentation can occur on your face forever. Thank you.
For more such videos, visit or log into dermavidya.com.